Okay, so this video is why didn't my doctor explain this, the truth about AFib care in 2025. So lots of times I get patients come to me and they are kind of complaining. They're saying, my previous doctor or my regular cardiologist doesn't seem to spend very much time explaining to me what AFib is all about or my heart rhythm problem. Many of them just spend 5 minutes and I can even never really ask them questions or get a good answer. Or some just kind of tell them they need a procedure and kind of push them towards a procedure. So let's talk about this today. What is the standard of care, or how is AFib being treated currently in the year 2025? Well, having done this for over 20 years and seeing thousands upon thousands of patients with atrial fibrillation, I've seen the different ways that people have been treated or not treated sometimes with atrial fibrillation. And yes, I definitely see the extremes. I do see that more and more people are not getting adequate explanations, and more people tend to be kind of pushed into a procedure. And I think that that's something that's been getting worse over the last 10 years. And here's my reasons or opinions why I think that's the case. So I think it has to do with, insurances are paying doctors less. As healthcare costs keep going up in all countries, especially the United States, where we spend 18% plus of our gross domestic product on healthcare, there is always a push to pay doctors less. And so on a almost weekly basis, I see things on my desk where an insurance carrier will say, we denied this or we denied that, because we're one of the few professions where we actually do the work and then beg for payment later on. Most other businesses, you give them the money, they give you the service. We provide the service, on the other hand, in reverse, and then beg the insurances for payment, because patients don't usually pay us directly. They're paid by third-party healthcare insurance. And as the healthcare insurances, which are led by Medicare, reimbursement or reduce how much they're paying doctors, then there becomes this kind of feeling among many doctors such that, I just need to see as many people as possible and possibly do more procedures because I get paid better or more for a procedure. So if the insurances are gonna, pay me less every couple of years, or they're gonna deny treatments, then maybe I have to just kind of do as much as possible, throw as much against the wall, see what sticks, and because I know I'm gonna lose some, which unfortunately leads to the patient not getting the best care, not getting adequate explanations, possibly being pushed to treatments that may make the doctor more money. I'm not saying that everybody does this, but I do see more and more people doing this. And their attitude seems to be, I gotta feed my family, gotta keep my income. And if the insurance is gonna screw me over, well, then I'm gonna screw them back, by playing their game. But the person who gets stuck in the middle is the patient. Plus, I also see the extremes. I see regular cardiologists practicing sometimes outdated medicine from 20 years ago when atrial fibrillation was still in its infancy and it really wasn't very good. Like I said, 25 years ago when I first came out of training, it took us 8 hours to do a one-wall AFib ablation, and you couldn't do anything more complicated than that. And the success rates were 50 or 60%. Fast forward 25 years. Now somebody coming straight out of training from a electrophysiology fellowship is trained to do that first wall. And even if they're still not very good at it, they could probably do it in 1 to 2 hours with our newer techniques and technology. And at an early stage of AFib, they could have a 70 to 80% success rate. So things have gotten much improved that way. But some regular cardiologists are still practicing outdated medicine, don't necessarily believe in the newer stuff, and they don't believe in ablations, and they say, hey, here's a rate controlling medication to slow your heart rate down, here's a blood thinner so you don't have a stroke, and live with it. AFib's not gonna kill you. And they don't aggressively treat it, or they don't really use very much drugs to suppress it. They almost never refer for an ablation. And so you do see patients saying, my doctor doesn't give me any options. They just say, hey, live with it, it's not gonna kill you, here's some medicines. So that's one extreme. And the other extreme is, because it has gotten a lot easier to do a simple one-wall ablation for AFib called pulmonary vein isolation, or PVI, which is getting electrically isolating the corners of that first wall, which is good for early stage cases of AFib. But in the later case stages, where like a forest fire, you have 2, 3, 4, 5, or 6 out of the walls of your heart with AFib cells, then just getting rid of one wall, 10% of the forest fire is not gonna get rid of all of it. But I see it's gotten so easy to do that. So a lot of times I see some less scrupulous doctors in my field pushing everyone to a procedure and just doing a simple one-wall ablation on them 3 to 5 times. And sometimes they get the result, sometimes they don't. But here's the problem. They make money every single time they do the procedure, because we don't charge people based on skill level. We don't charge people based on experience or results. It's assumed somehow that doctors all get the same results and we all do the same thing, which I don't know about you, but whatever business anybody else is in, what business or profession does everybody do the same thing and get the same quality of work? I mean, there is no business like that. whether you're a lawyer or a plumber, you could be better and charge more, or you could be less skilled and charge less, but doctors somehow do everything the same, and therefore there's just one billing code. So if, for example, if I specialize in advanced AFib ablations and I block out 4 hours to get rid of somebody's AFib who's had it for 15, 20 years and is almost permanent, it's on all 6 walls of the heart, and I somehow manage to get that result in one single procedure, and somebody else doesn't have the skill to do that, and they do one wall 5 times, or 1 or 2 walls 3 to 5 times, they're gonna get paid 3 to 5 times because they're using the same billing code as my one time. So there is actually an incentive sometimes to not improve your skills, to not to do more complex ablations because it's hard, and to just do a simple one wall ablation on everybody. And if you get the result, great. And if you don't get the result, well, every time you do it, you can bill for it. So this is why people say, why have I had 3, 5 ablations and I still don't have the result? Because they're not matching the lesion set with the stage of your forest fire, your AFib. So I see both extremes, and unfortunately that does contribute to this. And then lastly, sometimes I see them interact. I see some regular cardiologists practicing outdated medicine, and they don't really understand that AFib progresses, that like a forest fire, the bigger it is and the more walls it is on, the more time they're spending in it, the harder it is to get rid of it with an ablation. The more advanced lesion set that somebody has to do, and the more important it is to send them to somebody doing advanced ablations. They just seem to think it's, it's all or nothing. You get the AFib or you don't, and it's all the same. And so they do what they can do, which is medicines. They put you on medicines. Some of them may even put you on antiarrhythmic drugs to keep the AFib asleep. And then they'll wait 10 or 15 years until your AFib is 100% there, knocking on permanent stage where we can't get you out of it. And they basically have failed all the medicines, and then they send it to an electrophysiologist who doesn't do advanced ablations, maybe who's their buddy or who they know, and they go, okay, I've done everything I can. Now, I can't do anything more. The AFib's just too strong. Fix it. As if it's the same as if the person was at an early stage or 10 years earlier, and it's not. And then they send them to somebody who doesn't do advanced ablation, who does a simple one wall ablation, which is clearly not enough at that stage. And they do it 3, 4, 5 times. They don't get the result. And then the original doctor says, I knew these ablations don't work. See, that's why I didn't send in the first place. And now I'm not going to send in later on because it just doesn't work. And so it just feeds on itself. You have people kind of doing multiple really quick, fast ablations, 6 a day, 7 a day, simple one wall ablations, not getting the results for a lot of people. And then you have people who don't even believe in ablations, and then they influence each other. They make the people who don't believe in ablations think it doesn't work, I'm not gonna send anything more. So this unfortunately has become sort of the status of AFib care in 2025, which once again, this is why it's so incredibly important that patients educate themselves, advocate for themselves, search out what the actual facts are, and make sure that you go to a doctor who is competent, who can sit down and take the time to explain to you ethically what is AFib so you fully understand it. What are your treatment options? Rate control, rhythm control, ablation. What are the pros and cons? What makes sense for your specific situation? A young person might make a different decision than a 80 or 90-year-old elderly person, and then help you decide what is the best care for you instead of just going to a regular average cardiologist or electrophysiologist and getting a cookie cutter one-size-fits-all approach, which may not work for you. If you have any further issues or questions, I do second opinion consults. Feel free to go to drscottlee.com to click on that and find out more, or keep watching the AFib video channel, click subscribe if you find it interesting, and make sure that you advocate for yourself and for your loved ones, and you get the education because it is your heart and it is your heart condition that you need to take care of. For everything atrial fibrillation related, please feel free to go to my website, drscottlee.com, where you're going to find more resources and also can follow me on social media.